Hello, welcome to this anesthesia educational video. My name is Christina Castillo. I'm a student registered nurse anesthetist at Barry University. You are watching this video as a part of my DNP project entitled Teaching Intervention Evaluation on Anesthetic Risk Factors for Postoperative Delirium. By now, you should have already completed the initial survey, and if you haven't, you can click on the link below. Today, we are going to talk about the latest evidence-based anesthesia considerations proven to reduce the incidence of postoperative delirium. But first, some background. Post-op delirium is basically when someone acutely develops alterations in cognition and awareness within 24 hours of surgery and is most commonly observed in the elderly population. Did you know that it costs $164 billion annually in the United States? That it increases the rates of medical complications and hospital lengths of stay? Or that it increases the rates of short and long-term mortality? What's worse, treating delirium after it has manifested does not improve the patient's long-term mortality. So what does all this mean? It means that we must institute primary prevention strategies to prevent delirium and that our patients' lives depend on it, a sentiment echoed by the American Geriatric Society. All medical specialties, including anesthesia, have a responsibility to provide primary prevention. So the question is, what can we do and what applies to us? Our role can be divided into three categories: predisposing factors, precipitating factors, and additive anesthesia prevention strategies. Let's talk about the predisposing factors leading to increased post-op delirium. Wouldn't it be awesome if there was a quick, reliable risk scale, kind of like the APVAL PONV scale? Unfortunately, the research community can't agree on one that's reliable and valid enough for patient use because of study differences. Perhaps the most important thing that I would like you to learn from this video is the basic patient predisposing factors, so you can keep them in the back of your mind the next time you do a pre-anesthesia evaluation on a patient. The risk factors are patient age 65 or older, history of or current presence of cognitive impairment, including dementia, or history of postoperative delirium, a patient that has a current hip fracture, and finally, the presence of medical comorbidities or accompanying severe illness, such as diabetes, heart disease, or infection. Now that we know which patients are generally higher risk, what things can we avoid in the anesthesia plan to help prevent delirium? Drugs like benzodiazepines, anticholinergics, and meperidine, since it has a neurologically active metabolite. Techniques you'll want to avoid are too deep anesthesia, leaving invasive devices in place if possible, and under-treating the patient's pain. It doesn't matter whether you use opioids, regional, non-opioid, or a combination of all techniques. The most important thing is to ensure the patient has adequate pain relief, since undertreated pain contributes to more delirium. Now that we know what to avoid during the anesthetic to prevent our patient from developing delirium, what can we add to reduce their risk? Doing preoperative screenings. By helping avoid excessively deep anesthesia, the BIS has reduced the risk reliably and effectively in many studies. Hospital staff education on delirium, and multimodal geriatric care, which includes reorientation, individualized patient care, targeted patient education, and anesthesia plans that facilitate early mobilization. The goal of this project is to help CRNAs and SRNAs be more aware of the healthcare problem that is postoperative delirium. I want you to be cognizant of the patient risk factors during a pre-anesthetic evaluation. I want you to be inspired to consider alternative anesthesia techniques to prevent the problem. So from here, all you have left to do is the waiting period and the post-survey. You should continue to work in your normal locations and schedules. Reminder, you are not compelled to utilize any of the suggestions of this video, and your patient care is entirely dependent upon your clinical judgment. In about 2 months, I will send you a reminder to do the last survey. Thank you so much for your participation.